I'm joined now in studio by Dr. Lytton Smith. He is a member of the Orange County Medical Association. He's a family practitioner with a concentration in geriatric medicine. Dr. Smith, welcome to the program.
Thank you very much for having me.
Now, Doctor, we all know, and of course the statistics bear fruit to this, that diabetes is becoming an increasingly urgent problem worldwide. I mean, more and more people every day are being diagnosed with this disease.
That's true, and we've changed the diagnostic criteria, which is one of the big issues. And of course, people are living longer, which develops more and more people developing. And the last issue is the epidemic of obesity, which is a hallmark sign of diabetes.
Of course, yeah. I mean, you know, anytime someone is dealing with obesity, more than likely they're also probably, if not already, but are dealing with a diabetic condition.
Correct.
Now, as we saw in the piece that we just looked at, for someone who is trying to control their diabetes and perhaps there's too tight of control, as you mentioned before going on the air, it can cause a hypoglycemic condition, which now this study is telling us could lead to dementia later in life. What's your take on that?
Very big concern about this. In my training, we were always cautioned about the issue of hypoglycemia being more dangerous than hyperglycemia. Now, the newer thought process is to develop very tight control. Try to get very low blood sugars in the morning, maintain a very low sugar during the day. However, the cost of that is increasing episodes of hypoglycemia. And this study is a frightening thing to think that this might lead to dementia down the road, because dementia, as we know, is a major health crisis in America.
Well, of course, now, in dealing with your patients, and as we mentioned, you have a concentration in geriatric medicine, so you are dealing with patients that are, you know, fearful of one and probably dealing with the other. What can you take from this study to help your patients?
Well, I think the study is to be sure we don't create hypoglycemic episodes in our diabetic patients. There's not a lot of study that shows that very, very tight control improves the longevity of patients. I think we have to take a step back, look at our control of diabetes, and make sure it's appropriate, not too tight, but certainly don't want to have high blood sugars. I think we need to step back a little bit and say, are we doing the patient a service by keeping their sugars too low? And we think the big emphasis will be avoiding hypoglycemic attacks.
Now, very quickly, we're almost out of time, but you know, a lot of times you're watching television and it's beginning to look like in commercials that controlling diabetes has become a really easy thing, but maybe we're looking at it a little too lightly?
Absolutely. I think we have a new series of medications have come out because the understanding of diabetes has totally changed over the last 10 years. There are very complicated micro activities that are going on in the diabetic that we're just grasping right now. So the numerous medications are out there, but the emphasis should be good control, avoiding too tight a control, avoiding hypoglycemic attacks.
Sage advice. Again, Dr. Lytton Smith. He is a member of the Orange County Medical Association, and we thank you so much for your input.
Thank you very much for having me again.